Hello and welcome. Today, we're diving into a rare and fascinating condition known as urethral duplication. This congenital anomaly involves the presence of more than one urethra, and while it's not always life-threatening, it can present a variety of challenges for those affected. Join us as we explore the intricacies of this condition, from its origins to its management. The exact cause of urethral duplication remains largely unknown. It's believed to be a result of errors during embryonic development, specifically during the formation of the urinary and genital tracts. These developmental errors occur within the first trimester of pregnancy, leading to the atypical formation of the urethra. Genetic factors might also play a role, but further research is needed to fully understand the underlying mechanisms. The pathophysiology of urethral duplication hinges on the location and functionality of the duplicate urethra. In essence, the normal developmental process of the urethra is disrupted. This disruption can result in a completely separate functional urethra or a blind, ending pouch. The primary urethra may also be affected, leading to issues with bladder emptying, urinary flow, and in some cases, urinary incontinence. The specific functional impact depends on whether both urethras are patent and open, and whether both connect to the bladder. Urethral duplication is a rare anomaly. Exact epidemiological data is scarce, but it's estimated to occur in approximately 1 in 2,000 live births. It predominantly affects males, although rare cases have been reported in females. Due to its rarity, comprehensive population-based studies are lacking, making it difficult to ascertain the true prevalence and incidence of this condition. The signs and symptoms of urethral duplication can vary considerably depending on the type and severity of the anomaly. Some individuals may be asymptomatic, with the duplication discovered incidentally. Others may experience a range of symptoms including dribbling of urine from abnormal opening, urinary tract infections, pain or discomfort during urination, penile curvature, or even infertility in severe cases. In some instances, the presence of 2 urinary streams during urination may also be noticeable. Diagnosing urethral duplication often involves a combination of physical examination and imaging studies. A thorough physical exam can help identify the presence of additional urethral openings. Imaging techniques like voiding cystoarthrogram (VCUG), which uses X-rays to visualize the bladder and urethra during urination, and MRI, which provides detailed anatomical images, are crucial for determining the precise anatomy of the duplicated urethra and its relationship to the bladder and surrounding structures. Cystoscopy, a procedure where a small camera is inserted into the urethra, can also be used for direct visualization. Urethral duplication is classified based on the FMEN classification system, which categorizes the different types based on their anatomy and location. Type I is characterized by a single urethra that is either partially or completely duplicated. Type I involves 2 separate urethras, which may be either complete or incomplete. This type is further subdivided based on the location of the accessory urethra. Understanding the specific type of duplication is critical for guiding treatment decisions. Treatment for urethral duplication is highly individualized and depends on the specific anatomy, the presence of symptoms, and the degree of functional impairment. Asymptomatic cases may not require any intervention. However, symptomatic individuals typically require surgical correction. Surgical options range from simple excision of the duplicate urethra to more complex reconstructive procedures to create a single, functional urethra. The goal of surgery is to alleviate symptoms, prevent complications like UTAs, and restore normal urinary function. Unfortunately, there is no known way to prevent urethral duplication, as it is a congenital anomaly arising from errors during embryonic development. Genetic counseling may be beneficial for families with a history of similar congenital anomalies, but the predictive value is limited given the sporadic nature of the condition. The prognosis for individuals with urethral duplication is generally good, especially with timely diagnosis and appropriate management. Surgical correction can often effectively alleviate symptoms and improve quality of life. However, potential complications such as urethral strictures, fistulas, or persistent urinary incontinence can occur in some cases. Recent research focuses on refining surgical techniques and improving long-term outcomes. Additionally, advancements in prenatal imaging may allow for earlier detection of urethral duplication, facilitating better planning for postnatal management.